Hi everyone, I am Stephanie with 9 Health. This is Health Happens, our weekly Facebook Live show that we do to bring you the objective health information that you need. Today we're talking about Medicare. We're just a month away from open enrollment. We wanted to get you prepared because it can be confusing. If you qualify for Medicare, and even especially if it's your first time, or even if it's not your first time, maybe you need to change your plan, or you have questions about your current plan, or just questions about enrolling. I brought in Dr. Robert Morris. He's with Well Advised. Well Advised has partnered with 9 Health. They offer a free, unbiased online tool to help you determine your optimal Medicare plan. I put the link in the description for this if you want to check out Well Advised tools. Again, it's free. Helps you sort through all of the confusion, because I was just talking with Dr. Morris. Some of the terms are confusing, and it's helpful to have someone help you sort through it. So first, Dr. Morris, many might not know what Medicare is. Tell us what it is and who it's for.
Medicare is essentially a federal government system of healthcare insurance organized by the government, but largely delivered through private health companies. It's essentially for people who are aged 65 and over, but not completely. Some 9 million people or so with disability who are under the age of 65 are also covered by it. And I can talk about how they get onto it. That's about 17% of all Medicare people are under the age of 65. So the majority of people are over the age of 65. It is a system just for an individual. So there are no family plans. There are no discounts for families. It is just for a single person. Some companies with Medicare supplements do make adjustments like discounts for somebody else living with you or for a spouse as well. But essentially it's just for one single person, one individual. It is not free, so let's just make that clear. There are premiums that people have to pay to every month for various parts of it. It's divided in general into a hospital part, which is called Part A, and then what's called medical side, which is the providers outside hospital, physicians particularly, and outpatient services and so on. And that's called Part B. You will also know that there is a prescription medication plan, which is called Part D. D for drug, I'm hoping. And there's also a Part C, which is for what is called medical advantage plans. Those are plans that are essentially managed care plans, where you have a primary care physician who is essentially managing your care, and most of the care you receive beyond that primary care physician is referred through that particular physician. So that's what managed care is. And many of you will know companies that do that. Less than half, about 40% or so of people have managed care Part C plans, but the rest are in what is called original Medicare. We're already getting into detail, and I want to stop giving too much detail, because it gets confusing. But in general, there are two parts of Medicare that one can look at when you turn 65. One is what we call, as I said, original Medicare, where you are getting services on a fee-for-service basis. That is, the government will pay 80% of it, and you are responsible for the other 20%. That's of hospital fees and the physician fees and other services. In addition to that, you would have to have a prescription drug plan. And we also, in Well Advised, recommend that you have a plan, which is called a Medicare Supplement plan, that will cover your largely cover your out-of-cost out-of-pocket rather expenses beyond that. So that's one direction.
I was just going to stop you there because some things aren't covered by Medicare, right? I think people assume once they have whatever coverage they've chosen, they're good. But there's some things that aren't covered, like hearing aids, glasses, right? What's not covered under Medicare? Why would you need a supplement?
Well, the supplement, we need to be very, as I said, and you said, we have to be very careful about the language. Medicare supplement is about out-of-pocket expenses that you incur for the main things that Medicare covers. Even though Medicare covers a lot of things, it does look for you to be sharing the cost of those things. And in original Medicare, you can get an insurance which will essentially take care of at least most of those out-of-pocket expenses. What is not covered by Medicare is those things that are not necessarily medically prescribed. They're not necessarily medically necessary. And those can be things like in hospital, if you go into hospital, for instance, and you want a private room rather than a shared room, that would not be covered necessarily by Medicare. If you want some other things, very often people cite, oh, you want to have a TV or you want special services in hospital. They may not be covered and you may have to pay for those separately. So there are some simple things like that, but there are also some other big things that you've talked about just then as well. So you do have to be very careful. Medicare, I keep hearing people saying, oh, isn't Medicare free? Well, I wish it was, but it's not. And increasingly, the government wants you to be sharing the cost of it. And you have to be very careful about choosing the right plan that keeps those extra costs down. One other extra cost, for instance, is that some physicians that you may want to see do not, in fact, accept the fee that Medicare wants them to charge. And by law, they're allowed to charge up to 15% beyond the Medicare fee, but you would be responsible for that normally. And so you have to be very careful as to whether a physician that you're seeing outside your primary care physician does accept Medicare fees and the terms and conditions of the contract. So one has to be careful. So
yeah, and again, I just want to, for people that are just joining us, we're talking about Medicare, getting you prepared. Open enrollment starts next month on October 15th. So I brought in Dr. Robert Morris. He's with Well Advised. He's their chief medical officer. Well Advised has a free tool online. I put their link in the description. You can go on their website and it'll help you pick the right Medicare plan for you. So just talking a little bit about that, Dr. Morris, tell us, we talked about different plans and the different parts of Medicare, but what or how does Well Advised help consumers choose the right plan for them? How does that work?
Well, let me give you an example. Most of us can choose, when we go to the supermarket, we can choose between 5 or 6 different sorts of breakfast cereal, all of which have got much the same content and much the same things, and we can make a decision as to which one they have. With Medicare, there are, in Colorado, for instance, there are 34 Medicare Advantage plans. There are 26 prescription drug plans, and there are 345 Medicare Supplement plans, each of which of those plans can be joined to a prescription drug plan. So you have a choice to make of one in about 9,000 when you first enter Medicare. I don't think you can do that. I can't do it, certainly. So what we do have is some very clever computer systems that will help us do that. And how we do it is that we look at your preferences are about your physician, your hospital, some idea of what your finances are as well, and other things that you like and dislike about the healthcare you get and how you want to receive it in the future. And our system can select the specific plan or set of plans that match your preferences and your needs. And we then make a recommendation to you that we can back up with pre-filled application forms that you just have to sign and send back to us and so on, and make the whole process as easy as possible for you. If you don't like the plan that we sent you and it doesn't match, you think what you need, or you change your preferences, it's easy for us to change that as well. So that's not an issue. So that's how we do it.
And someone, Lou, just said in the comments that she tried the well-advised link and it told her she wasn't eligible. I just went in and tried it. I put a birth date that would make me about 65, 66, and it let me in. So maybe just try again, because when I just tried it just now, it worked for me. So
Right.
Hopefully you get that to work with.
And we do get that. What we do, the first thing we do is when we look at somebody's birthday is to understand, are they in fact eligible through by age for Medicare? And that means, are they within 3 to 6 months of being 65? Because if they are, then we can handle that. If they're under 65, at the moment we can't, but that is changing in the future, because we know that people coming up to the age of 65, maybe they're 62, 63, want to know, well, what's it going to cost me when I retire? And it's a very common question. You know, what's it going to cost my wife, my husband? You know, are my children going to be covered? So, and so on. So all those things are what we're essentially what we're about.
And you did mention at the start of this that there is a small percentage of the population under 65 that does qualify for Medicare.
That is correct.
So they're not able to go on and use your tool yet?
Not at the moment, no.
Okay. And who are those people again that qualify that are under 65?
They are people who currently they either retire early and are on Social Security retirement benefits early for some reason, but also if they're disabled and they receive Social Security disability income, SSDI as it's called, and they've had that for 24 months, they become automatically eligible to join Medicare, and also people who have got ALS as well.
And then just coming back to some of the questions I had for you. So say I've just retired, I'm 65. Am I enrolled automatically when eligible into Medicare? How does that work?
You're not enrolled automatically, no. Most people are not, and you have to sign up. And there is a 7-month period when you can sign up for Medicare. That's Part A and Part B, if you want Part B as well. The 7-month period is, in the middle is the month of your birthday. Then there is 3 months prior to that and 3 months after that, making 7 months altogether. So if you're 60, I won't go into all that, but in the detail of that, but that's essentially what it is. The month of your birthday, 3 months before then, and 3 months after then. And the importance of that, and we call it an initial enrollment period, is that you have got certain rights about the insurance company not being able to take into account any pre-existing illness, and certain rights about the insurance companies in a particular way have to take you, whether they want to or not, and they can't charge more either. So those two things are very important, and that's why we put a huge emphasis on the initial enrollment period. When we're talking about that, one of the things that we've got coming up is this thing called open enrollment, and it's really called annual enrollment. Insurance plans under Medicare run from January the 1st for a calendar year. So what this time is about is it's an opportunity for you to look at what the sort of health that you're getting and health insurance you have at the moment, and whether it suits your particular needs, both financially and in terms of the benefits you get, and look at what are the plans that you have available for next year, either with the same company, same plan, different plan, or with a different company. So this is a good opportunity to review what you've got, what you think you're spending. Is it too much for you? Is there an opportunity for you to change a particular plan? This period from October 15th to December 7th is a very crucial period for people who are either unhappy with their plan or think that they want to have something less expensive or just with better benefits. It's a very good time to start reviewing it. How do you review those plans? Well, we can help you, first of all, obviously, by looking at your current needs, your current preferences, and say, because we have access to all plans in Colorado, and all companies, and we're not associated with any of them. I mean, just make that clear. We can search those and find out which is the best plan that suits your current needs and current preferences. And if we do that, we can sign you up, and the new plan would start on January the 1st. So there are a lot of opportunities there. I should also add, of course, that we are a free service to you. We do not cost you anything. I want to make that clear.
And someone else commented, Sue, in our comments that she's not able to get in, but she turns 65 in January. And you had said sometimes the website won't let you in if it's before 3 months.
Right.
Right.
So October the 1st will let her in.
Okay.
There is a trick around that we sometimes use, which is, and I shouldn't really tell people this, but we sometimes use false birthdays, just so that people can get an idea of whether, in fact, what it would cost them.
Well, and that's what I did I'm not 65 yet, but that's what I did when I
really?
went to just see if the site was working.
I'd never have guessed.
I did trick it just because someone said they couldn't get in at all, that the link was useless. So I went to try just to like make sure it was actually working. And when I put my birthday in as 1953, so I think that makes me 66.
That is something that we have in plan. It's part of our strategy to enable people to take a look ahead. It's what I was talking about before when people are 60. So the viewer who just said to you she couldn't get in, but she's 65 in January. Well, in October, November, December, the 3 months before her 65th birthday month, she will certainly be able to get in if we haven't changed it by that time. And
the open enrollment, annual enrollment period isn't, on one day, so she'll have time.
Absolutely, yeah. As long as annual enrollment ends on December the 7th, the reason for that, we think, is that it enables insurance companies who have a lot of work coming in, a lot of new business coming in, new applications coming in, to get everything ready by January the 1st. So that's the reason why it ends then. You actually have another opportunity after that, though, because there is what's called managed care, Medicare Advantage enrollment period. As I said, the names are awful, but that's an open enrollment period which starts January the 1st until March the 30th, when there are certain other changes you can make. And that's important, because if you find that you've changed one of your plans on January the 1st, because of open enrollment, you changed it, and you don't like it, you have one opportunity between January the 1st and March the 30th to change again, or change back, or make some other adjustment. So that's why so it's almost a 6-month period of being able to change your plan. And we always say, once you're on a plan, you can't change it. Well, actually, that's not true. You can. There are a lot of opportunities to change, but you have to be very careful how you do it, because one of the things you don't want to do is to be charged more or get denied because of some present illness that you've got.
And Valerie asked, she turned 65 in April. I'm collecting Social Security retirement early. Should I enroll in October or wait until January? Can she use the well-advised services? So several questions. I'll let you start with those ones, and I'll ask her last question that she had in here.
When she said that she's 65 in April, does it mean next April 2021?
That's what I'm assuming, yes. 65. Okay. 65 in April. I'm collecting Social Security retirement early. So yeah, I'm thinking April of 2021.
She can certainly go online and put in a fake birthday. We don't like her doing that, but that.
So should she enroll in October or wait until January then? Or
I
can
would.
she even?
Oh, she can wait until her 65th birthday.
Okay, so Valerie, if you turned 65 this last April, we weren't sure about it, that in your
Right.
question, then October, anytime right now, like in October, she can
She
enroll.
should. Yep.
But otherwise, you can wait until
That's
you're
correct.
actually 65. And then she said, my Kaiser plan with my previous employer ends at the end of September. Will she be without insurance until January? So maybe she did turn 65 this last April.
Right. That sounds to me as though she did, in which
Yeah.
case she should enroll. Well, she should find a plan, go through us and find a plan, first of all, that suits her needs. And we can certainly help her with that, and we can give her advice about the enrollment. And the sooner that she does that, the better. If her, this applies to anybody, if your current insurance does end, you can always go on COBRA, COBRA, if you've had your insurance through an employer, and that will cover you. It's expensive, but we always suggest to people that they don't actually need to meet that obligation to pay immediately. You can delay that, and you have an extra month or two in which you can choose a plan through us, and we can process that very quickly.
And I've kept you for a while, but before we let you go, I just wanted to kind of recap. We talked about this at the very beginning, but there are different Medicare plans. Briefly talk about the plans and some of the differences.
Right. Yep. The differences between the plans, as I said, first of all, there's original Medicare plus a a prescription drug plan, and plus a Medicare supplement plan. Those three together make what we call an original Medicare package. The alternative to that is managed care through an HMO, essentially through an HMO, sometimes PPOs, sometimes, which is a preferred provider organization. But those are essentially network managed care organization. And they're becoming increasingly common. Let me just add one quick thing before we do go, and that is, I was just looking at the differences in some of the premiums and deductibles and co-insurances that are likely to happen. Very few people pay any premium for their Part A, and I have to look at this because it's complicated. If you go into hospital for any period of time under original Medicare, you pay $1,408 for the first 6 months of care this year. That's going up to $1,452. So that's going up quite a considerable amount next year. There are some changes to the co-insurance that you would have to pay per day on the top of that. For Part B, there are some changes there. Most of them are fairly minor. One big one, however, is that the maximum out of pocket that you would have to pay under managed care has gone up from $6,700 per year to over $7,500. These figures are fairly provisional. They don't get confirmed until October the 1st, but that is quite a big change. Most companies don't have that as a maximum, they have less than it. But some companies will want to go up to the maximum out of pocket that you have. So those are some big changes that have. There's one other big change, and that is that people who have end-stage renal disease this year had problems getting Medicare. It was a complicated process. In 2021, they will all be eligible to go direct into Medicare without any waiting time at all. So those are some of the changes that I've come across for this coming. We will know more about what the plans look like on the 1st of October when they're officially published. We will have some better knowledge, I think, of some of the new plans that there were in Colorado. There were a lot of new plans in Colorado this year. there will be some record of the member experience of those plans that we can use as well. At the moment, we don't recommend new plans because they're new, because there is no evidence of member satisfaction of them. We prefer not to. So that hopefully that will change for next year.
So I'm about to let Dr. Morris go. If you have any additional questions, you can post those. Valerie did say she's 64 now, turns 65 in April 2021. So then she would be eligible next fall.
That's correct.
Okay, for that open enroll. If you turn 65 in April, can you enroll still?
Oh, yes.
Okay, so when you turn 65.
Absolutely.
You don't have to wait for annual enrollment or open enrollment.
No,
So,
you have this special initial enrollment period when you turn 65.
Perfect. And then Sue did ask, can we call and talk to someone? So is there a phone number with Well Advised? I see on the website there's an email, which is info@well-advised.com. I can put that in the comments.
Yes.
Is there a phone number people can call?
There isn't a phone number that people can call directly to speak to one of us. What we do is that we establish an appointment with you, with the person to speak to, and it's usually at their date and time, their convenience. We do not call people. We do not make solicitation calls at all. We don't do robocalling or anything like that. We don't think that that's, well, I hate it personally. And if I don't want it, I don't see why other people should have it either. So,
but if Sue emails, then she can potentially make an appointment to talk with a human.
Yes. We would prefer it if what she would do would be to fill in the questionnaire first.
Yeah, she was just having trouble getting in, so she was asking.
That's fine. That's fine. Now I understand. Thank you.
Yes, she was the one that was having trouble getting into the site. And
one other thing, Stephanie, I think that we will do is that we will put something on our Facebook site and probably your Facebook site as well. It's the Well Advised Facebook site, to an illustration of some of the questions and some of the detail, because necessarily I've cut short an awful lot of the detail.
There's a lot to cover, and there's a lot with Medicare, but we definitely want to give people the opportunity to ask the questions if they had them, kind of just alert them that now's the time to start preparing so that you're ready next month when that annual enrollment opens.
And I think on your site, you will see how to get onto our website, Well Advised website. It's well-advised.com. And if you want to go onto our Facebook site, it's at Well Advised Health Services, one word.
Yeah, and I can I'll put the Facebook page link in the comments as well.
You.
And again, if people have additional questions, you can comment after this live is done, and I will pass them along to Dr. Morris and Well Advised, and we'll reply back to you. I have a couple things before we go as well. A reminder that there are fall 9 health fairs this season. You can go to 9healthfair.org and find a fair near you. We're only running about 8 due to the pandemic. We're kind of just seeing how it goes, but we wanted to offer in-person health fairs this fall. You can get a free flu shot, get your preventive blood screenings done, all for a low cost. Again, the flu shots are free thanks to Safeway and Albertsons. And again, we've partnered with Well Advised. They offer that free unbiased online tool. The link to their website is in the description for this Facebook Live. It's a tool to help you pick the best plan for you, kind of sort through some of the confusing things with Medicare, and just either change your plan or pick a plan to start with. Dr. Morris, I want to thank you so much for joining us, and I'll let you go.
My pleasure. Thank you so much.